I'm Peter Shin. I'm an associate professor of health policy at George Washington University. I was born in Seoul, Korea, and I came when I was about 5 years old. George Washington has a number of partners in the local area, one of them being Unity's Upper Cardoza Health Center. And we do a number of research projects, including looking at the quality of care, as well as placing students, whether at the master's or doctoral level, to do their internships or their research projects. There are about 1,200 health centers nationally, serving across 8,500 communities, over 20.2 million low-income populations. When I was at Oberlin College, I really caught the policy bug of really trying to understand how policymaking affects society. Once I understood the value of public health and how policymaking can affect programs on the ground, I really wanted to go to a place where I can really learn to do that stuff. And obviously George Washington University being in the capital and having a great program was really enticing, and that's the reason I came to GW to do my master's and my doctoral work. I think students really get excited about the fact that they're going to be able to engage in policies that's emerging. The syllabus doesn't reflect something that was done a year ago. It will reflect what's happening now. And it's an exciting time right now because we have health reform, and we're talking about trying to address some of those issues by building up capacity, by thinking about where the access points are. We're able to do a lot of fast turnaround work for policymakers in terms of how emerging legislation or regulations are going to be affecting health centers in terms of how they function, how they are financed. My grandparents are probably the primary reasons why I am here today working in health policy in an academic setting. This is my paternal grandfather, who was a physician in Korea and was one of the first modern educated physicians in the rural parts of Korea, and basically was helping to sort of rebuild the healthcare infrastructure there after the Civil War. And I certainly had an appreciation for what they were doing, not only in terms of rebuilding, but out of their own personal behavior. Policymaking should be reflective of the values that you bring to whatever field you're doing. And so when I think about policymaking, I'm thinking about things that I really do believe in. This is the George Washington University, and what we make is history.